quite a process. You can't do this without a team, and I was given multidisciplinary approach to acute ischemic stroke, and so I'm going to talk to you about kind of our experience and what we've done. And so go ahead. I have no financial relationships to disclose. Intraarterial use of TPA is off-label. I don't plan to discuss that, but just in case I do, there you go. What are our objectives? So I want to present you with a clinical scenario of what it's like to present a patient and to have a patient, and what our follow-up looks like. What are the elements of a multidisciplinary stroke team? What are our training requirements? What are the quality measures we follow? And what are our outcome measures? So what we have is we have a monthly CME stroke conference, and we have several members. And we take attendance at this conference. Everything is recorded. And at this meeting, there were 6 physicians that were present. There was the ER physician, a IR physician, a neurosurgeon, a neurologist, 2 internists. There were 4 of our stroke RNs. We have 5 RNs, our advanced practice nurses that are taking stroke call. We had 2 cath lab personnel, a pharmacist, and then 4 others. This patient that was presented was an 87-year-old male that was admitted on February the 12th for clot retention after he became disoriented and pulled his Foley catheter out. He was recently discharged with a MI. He had been on aspirin, and they had stopped the aspirin. His in-house stroke was on February 24th at 7:50. A nurse was feeding him breakfast, and he became aphasic, had a left gaze deviation, right visual field deficit, and right hemiparesis. His NIH stroke score was 27. Here's his non-contrast CT of the head, and again, this is performed and read within 45 minutes. And the only thing we see here on the left is we see a little bit of periventricular white matter changes, kind of watershed distribution, left greater than right. There's no bleed. Maybe a subtle loss of gray white matter differentiation on the posterior frontal lobe on that left side. When you look at the bone windows, you can see that his cavernous internal carotid artery is pretty heavily calcified bilaterally. All of our patients that we consider for intervention undergo a CT angiogram, non-contrast CT first, and then CT perfusion. The CT perfusion package is actually part of our angiogram, and we do an angiogram from the arch to the circle of Willis and a little bit above if their creatinine's normal. So here we see in the image on the left, that's our mean transit time, and that correlates with how long is it taking the blood to get to the brain. Cerebral CBF is cerebral blood flow, and that also correlates with how long it takes blood to get to the brain. CBV is cerebral blood volume, and that is your end, or your kind of homeostatic image. So this is brain. What the difference between the CBF and the CBV